Hello, my name is John King. I'm a family physician practicing in Milton, Vermont, and professor of family medicine at the University of Vermont Larner College of Medicine. We frequently precept students in our office setting that requires our physicians to meet national productivity goals, while at the same time giving students exemplary education. The challenge of incorporating a student into your busy practice can be significantly enhanced by a well-planned orientation of the student. The orientation process sets the stage for a positive experience. At the end of this session, you will be able to orient medical students to your practice in a way that enhances their learning experience. This orientation includes 4 key components. These are relationship building, assessment of a student's learning needs, office orientation, and discussing your teaching and feedback plan. Research has shown that exemplary preceptors are adept at planning and preparing for the student's experience. Highly rated preceptors actively involve students in learning, promote autonomy, engage students in self-reflection, provide immediate feedback, and create a comfortable learning environment. Let's explore these 4 simple steps that set the stage for a professional relationship with the student, creating a positive learning environment. Let's start with relationship building. Human connections are critical to all our endeavors. Forming a connection with your student is just as critical as that connection that you develop with patients to garner their trust and respect. Ask the sponsor of your student to provide a brief bio of the student's interests and review that prior to the student's arrival. Communicate with the student before they arrive and be sure they know where to go, who will be greeting them, and what their daily schedule will be for the time they are with you. It is very important for the student to be welcomed and expected on the first day. This welcome doesn't have to be with the preceptor, but prepare your staff so the student can be greeted as an expected guest. When you review the student's schedule, point out differences from the normal routine. It's also a good idea to ask students if they have any special schedule needs during their rotation. Does the student have a specific time that they need to be away during the time you are responsible for them? This could be anything from scheduled time to breast pump or attend a doctor's appointment, or a weekend free to attend a wedding. Asking students about this sends a strong message that physician well-being is important to you. If it isn't, then you might want to reconsider your own life choices. Relationship building can occur around one or multiple domains as are listed on this slide. Depending on your time with a student, perhaps exploring the student's professional interests seems most natural. Just be careful here not to make unprofessional remarks about other specialties to avoid offense, which will reduce your respect. This information and your conversation will provide a springboard for you to take the next step in orientation to assess student learning needs. Medical students in the clinical years have a wide range of experience and ability based on past work in clinical practice, for example, as a nurse, EMT, or phlebotomist. Their personal ability in clinical medicine, this work comes to some more naturally. Current progress through the curriculum, for example, first versus third year clerkship, or which rotations they have already completed by the time they reach you, or a fourth year student interested in a particular specialty, or how different your workflow processes are compared to others the student has experienced. Medical students also have different learning needs. They may have a preferred learning method, such as reviewing and reading review articles, a particular favorite online secondary literature resource, audio tapes, or a hands-on approach. You can get at these learning needs by asking questions like, tell me about your clinical experience and skills so far, or what would a successful rotation look like for you? Or, for a particular day, what would you like to focus on today? Orientation to your practice is a critical function that can be performed by a staff member with your emphasis of key points. Orientation to your practice is central to creating a positive learning environment. Important things to review with a student include a written schedule of the student's activities and work time, as we've discussed, key personnel and functions of all your staff, consultants and other facilities you use, type of patients you see or don't see, What access will students have to the electronic medical record, and will they be able to enter information, which is highly preferred? Specific activities you and your practice participate in, and whether the student will be involved, such as hospital rounds, nursing home rounds, house calls, community activities, or administrative meetings. And of course, your specific expectations of the student: dress code, expected break or lunch time, preferred reference resources you expect the student to use, and of course the schedule, as we discussed. The last step outlined here is to give your student an idea of how you will be teaching them and giving them feedback and a summary evaluation. Students learn the most when they are able to see and present patients to the preceptor. It's a good idea to let the students know how much time you have for each patient and how much time you want them to spend with the patient. This can be done as a general rule and tailored depending on how the day is going and which patients you are going to have the students see. For example, you could say, go see what you can find out about this patient's history in the next 10 minutes, and then come in and we can do a physical exam together. Afterwards, I'll give you feedback on your HPI. Here you've oriented the student to the encounter and told them how you will be giving feedback. Frequent, timely, and specific feedback on students' performance is ideal. Let the students know in advance that you will be giving feedback regularly throughout each day. In terms of a summary assessment, students should also be made aware of how you will grade them at the end of the rotation. One good way to do this is to review the summative assessment form used by the student's sponsor at the start of the rotation. Give the students some examples of specific honors behaviors that you have observed. For example, at your level, I give students honors who can give me a differential diagnosis with 3 common causes of a problem. Or, at your level, I give students honors who are able to use the teach-back technique when educating patients about their problem. By direct observation and interview of exemplary preceptors, researchers have found that planning and preparing, which included assessing students' clinical abilities, tailoring experience to their level, selecting appropriate patients, developing a supportive interpersonal relationship with the student to facilitate learning, are all important. As a preceptor, you can be well along this path with a thoughtful and thorough orientation that includes relationship building, student assessment, orientation to your practice, and communication of how you will teach and give feedback to the student. For more information on specific teaching techniques, see other videos in this series. Have a fun day teaching.